everyone, and welcome to today's lunchtime webinar on digital health in aged care. Before we get started, I would like to acknowledge the Ngunnawal people as the traditional custodians of the land on which we're meeting today, and pay my respects to the elders past, present, and emerging. And I'd also like to extend that respect to any First Nations people joining us for today's webinar. Today's webinar focuses on My Health Record in Aged Care and the Vulnerable Populations COVID-19 Vaccination Program. I am Mikaela Leva, Quality Improvement Project Officer at Capital Health Network. Also joining me today is Hope McMahon, the Older Persons Health Planning Manager here at CHN, and Kanal Mahiti, our Events Manager. Just before we get started, I'll run through a little bit of housekeeping. So all participants have been muted. Please address any questions that you have in the Q&A section, not in the chat box of the side panel of your Zoom window. We will have time for a question and answer session at the end of the presentations, and the presentation itself will be uploaded to the Capital Health Network YouTube page, and you are welcome to share this amongst your networks. Regarding CPD, please fill in the post-event evaluation survey from today, and CHN will email you with a certificate of attendance for the event. Depending on timing, please feel free to report somewhere between half an hour and 1 hour for today's session. All right, so I'm going to jump in then with what is My Health Record. My Health Record is a summary of an individual's key health information. It is personally controlled, which is a key element of the system. What this means is that an individual has a say as to what gets uploaded, what stays in their record, and who can see their record. Importantly, My Health Record is part of a national system, which means that an individual's My Health Record travels with them, wherever they are and no matter which registered healthcare provider they are seeing. A resident's My Health Record is accessible at all times, including at the point of care, by the resident, their representatives, and healthcare providers who are involved in their care. The resident's record can be viewed and added to, however, this is subject to access controls set by the resident. My Health Record is private and is protected via legislation, including the My Health Records Act 2012. My Health Record is secure through multiple layers of international best practice IT security. The following slide shows you the list of available documents in My Health Record. There are 3 sources of information that is entered into a My Health Record. These include healthcare provider entered data, which are clinical documents such as health summaries, discharge summaries, pathology results, and specialist letters. There are also Medicare source information, which includes Medicare benefits and DVA item numbers, PBS claims, Australian Immunisation Register data, information recorded on the Australian Organ Donor Register, and My Medicare information. Lastly, there is consumer entered data such as personal health summaries and advanced care planning documents. With functionality coming soon, there's the residential care transfer reason, a document generated by a residential care facility containing details of an individual's transfer from residential aged care setting into a hospital, which includes provider information, reason for transfer, and date of transfer. The upload of this document triggers the creation of a residential care transfer overview. There's the residential care medication chart, a record of orders and administration of prescription and non-prescription medicines and nutritional supplements for an individual being transferred from a residential care facility to a hospital. And the residential care health summary, a document containing information about a residential care individual's environment, health, and care to support continuity of care during their transfer to a hospital. To assist healthcare providers with easily finding the most relevant information or documents, the My Health Record system generates consolidated views, which are shown on this slide. These include prescription and dispense view, medicines view, Medicare overview, immunization consolidated view, along with pathology and diagnostic imaging report overviews. An overview screen with information about an individual's transfer from a residential aged care setting to a hospital will be coming shortly. And this overview includes a summary of the individual's information in My Health Record. This transfer information supports safe, effective communication and continuity of care. The potential benefits of My Health Record can be seen in three key areas: the health sector, healthcare organizations, and individuals. In the healthcare sector, the benefits include improved continuity of care, reduced duplication and wasted resources, streamlined information in one secure location. Healthcare provider organizations can benefit by reducing time spent gathering health information, improving decision support, and saving time in emergency situations. For the individual, they have enhanced patient self-management, and all of these benefits lead to improvements in outcomes for a resident. Adding value to clinical practice, My Health Record is a great digital tool containing a range of information that can support clinicians, but you may still be wondering how it can add value to clinical practice. Access to the medication and allergies information in the medicines view provides key information that can help facilitate medication reconciliation tasks. We know that this in turn plays an important role in reducing potential medication errors. Access to a resident's medical history, for example, in a shared health summary, can also help facilitate assessment for healthcare staff, saving them time having to collect the necessary information or having to rely on the resident's ability to be able to recall their own medical history accurately. Remembering that My Health Record is not designed to replace other sources of information available to you, but rather to enhance the information available. Also, My Health Record acts as a great platform to give residents the ability to share information, such as their advanced care planning documents, which clinicians can access to be able to understand and comply with their end-of-life care decisions. Healthcare provider organizations need to register with the Healthcare Identifier Service to be able to access the My Health Record system. Their authorized staff are then able to view and upload information into My Health Record, either via conformant software, or if the software used by the organization is not conformant, then authorized staff can access My Health Record via the National Provider Portal, which is a viewing-only platform. Consumers can view their My Health Record via MyGov linked services or authorized apps such as the My Health app. To add information to their record, they need to log into the My Health Record system via MyGov. So what is the My Health app? The My Health app was developed by the Australian Digital Health Agency and can be used by the My Health Record owner or holder, as well as any authorized and nominated representatives that may have access to their key health information in My Health Record. This free app can be installed on a mobile phone or tablet, but please note this is not available on a laptop or desktop computer. Residents and any representatives they may have can use the app to view information such as immunizations, medicines, and test results on their mobile phone. The home screen displays several tiles that let them easily navigate the health information contained in their My Health record. In addition to allowing access to view information in My Health record, another great benefit of the app is that residents and their representatives can share clinical documents with you as the resident's healthcare provider. This can be extremely valuable when you cannot access their My Health record. So the My Health record system can be accessed in two ways. The first of which is on the left, which is accessing it via the clinical information system in your practice or home that automatically connects to My Health record. However, not all software connects to the system. In these cases, the best option would be option 2, which is to access My Health record via the National Provider Portal. This still allows secure access to a resident's My Health record, but via a web-based platform instead. This is, however, a read and download only option, and you cannot upload any clinical data into the system this way. A very common question that healthcare providers ask is whether you need permission to access a resident's My Health record. Any healthcare provider involved in a person's healthcare who is authorized by their healthcare organization can access a My Health record. They do not need additional permission of a person to view their record, and a person's record can be accessed outside of consultation times, if access is for the purpose of providing healthcare. This also applies to uploading information to My Health record. A healthcare provider is authorized to upload. However, they must comply with any request from a resident who does not want information uploaded to their My Health record. Providers are under no legal obligation to use the My Health record system. It is up to the clinical discretion to decide when it might be useful to view or upload information. There are also some controls at the patient level, which are an integral feature of the My Health record. Firstly, the individual can choose to restrict access to specific documents in their My Health record. They can then establish a limited document access code, which they can provide to organizations that they wish to have access to those restricted documents. They can also restrict access to their record by establishing a record access code. That will mean only organizations given the code can access any part of their My Health record. If it is necessary to lessen or prevent a serious threat to life, health, or safety, a clinician can exercise the break glass function, also known as emergency access. Individuals can also subscribe to SMS or email alerts that report in real time when a health provider organization accesses their My Health record. Another safeguard of patient privacy and access is that all instances of access to My Health record are monitored and logged. Protection is offered by legislation that governs the way data is managed by the agency and healthcare providers accessing the data that it holds. Legislation includes the following acts. In addition, most healthcare providers have obligations to protect personal and health information under the Australian Privacy Act. The My Health record system is managed in line with the Australian Government Protective Security Policy Framework. My Health record data is stored in Australia and is protected by high-grade security protocols to detect and mitigate against external threats. The system is tested frequently to ensure these mechanisms are robust and working as designed. Design features include many safeguards to protect the information stored within the system, including audit trails, technology and data management controls, as well as appropriate security measures to minimize the likelihood of unauthorized access to information in a person's records. In addition to these measures, the My Health Record system is protected by the previously mentioned legislation, which governs the way the system is accessed, managed, and used. The emergency access provision can only be used if the healthcare provider reasonably believes that the access is necessary to lessen or prevent a serious threat to the life, health, and safety of an individual, and reasonably believes it would be unreasonable or impractical to obtain the consent of the healthcare recipient whose My Health record is to be accessed. Or the healthcare provider reasonably believes that access to the record is necessary to lessen or prevent a serious threat to public health or public safety. Please note that emergency access does not need to be used if you can already access the individual's My Health record using the usual processes. My Health Record is there to assist providers deliver better healthcare for their patients, and this is the authorized use of My Health Record. Appropriate access and use of the My Health Record system is taken very seriously. The My Health Record legislation is all about encouraging the use of My Health Record by clinicians and not focusing on penalizing. So if you are a clinician providing healthcare, then you are encouraged to use My Health Record. However, inappropriate use of My Health Record can result in penalties. There are significant fines and penalties for inappropriate or unauthorized use of information. Penalties may be applied for a few things such as unauthorized collection, use, or disclosure of health information in a record, use of health information in a record for prohibited purposes, unauthorized use or disclosure of healthcare identifiers or other information obtained for the purposes of the healthcare identifiers service, failure to give written notice within 14 days if the healthcare provider or organization ceases to be eligible to be registered. Please notify the agency if you or your organization ceases to be registered. Failure to notify an actual or potential data breach in which the healthcare provider or organization were directly involved. And holding, taking, processing, or handling records held for the purposes of the system outside of Australia or causing somebody else to do so on your behalf. Emergency access is not designed to be used to check whether any restricted documents exist, except in accordance with Section 64 of the My Health Records Act, where the treating healthcare provider reasonably believes that the access is necessary to lessen or prevent a serious threat to an individual's life, health, or safety, and it is unreasonable or impractical for them to provide consent or to lessen or prevent a serious threat to public health or safety. To gain access when an individual has forgotten their access code, except where there is a serious threat to the person's life, health, or safety, or to view your own My Health record or a record of a family member or friend. It is important to note that unlawful use of the emergency access function is subject to civil and/or criminal penalties under the My Health Records Act, as was discussed in earlier slides. There are 5 key participation recommendations for My Health Records. Number 1, all organizations engaging with the My Health Record system must have a My Health Record security and access policy in place, and these must be in place prior to registration into the system. Number 2, when registering for the system, you will be required to nominate the roles and responsibilities, including the RO and the OMOs for your organization, as well as set up your structure within the healthcare identifier service. This is why it's important to be aware of these concepts prior to registering for My Health Record. Once registration is complete, you can then train staff to use the system appropriately and ensure users are authorized to be accessing the My Health Record system. Number 4, it's also important to be aware of the ongoing participation obligations for using the system. And number 5, there is in-depth information for each of these stages, which will be available on the digital health website with links to these resources in subsequent slides. There are 2 types of representatives for a My Health Record, which include nominated and authorized representatives. First, we'll look at authorized representatives. An authorized representative is a person who has parental responsibility, legal authority, or is otherwise appropriate to act on an individual's behalf. An authorized representative is typically a parent, carer, family member, legal guardian, or someone with enduring power of attorney. An authorized representative has complete access and control over the person's record as if it were their own, so they can view, remove, and add information and choose whether Medicare information is added to the record. They can also choose which healthcare provider organizations can access the record, restrict access to specific documents within the record or to the entire record, add or remove nominated representatives, view other authorized representatives, and cancel the record to delete it. An authorized representative must make reasonable efforts to identify and support the will and preferences of the person they represent. If the will and preferences of the person cannot be identified, an authorized representative must act to promote the person's personal and social well-being. Something to note is that a person can have one or more authorized representatives if they wish. So we'll now look at the other type of representative, which is the nominated representative. Nominated representatives are people that the My Health Record holder or the authorized representative of the My Health Record holder can invite to help manage the My Health Record. This is a person they trust, and there is no limit to the number of representatives that a My Health Record holder may have. Having a nominated representative is especially useful for older Australians who require assistance, people with disabilities, and people who speak English as a second language. A record holder or their authorized representative has complete control over what a nominated representative can see and do in their My Health Record. What they have access to depends on the level of access they are granted. There are 3 level options: general, restricted, or full access. A nominated representative with a general access level can view all documents except those the person who holds the record has set as restricted access. They cannot give another person access to your record, change the access level for other nominated representatives, or remove other representatives, make changes to Medicare information, remove documents, add information, or cancel the record. A nominated representative with a restricted access level can view all documents, including the person have set as restricted access. They cannot give another person access to your record, change the access level for other nominated representatives, or remove other representatives, make changes to Medicare information, remove documents, add information, or cancel the record. That's a lot of information to take in a short period of time. So we'd also like to direct attendees to some other resources that are helpful in registering and navigating my health record. So the Australian Digital Health Agency provides a range of online training e-learning modules that can be accessed via their website and contain helpful videos with how-to instructions on navigating the My Health record. We've also included some links today for further information and resources via the Digital Health website. And if you require support to register for My Health record, the following support is still available. Finally, the Department of Health and Aged Care have released the Aged Care Data and Digital Strategy and Action Plan this week, which detail digital health in aged care over the next 5 years, including the use of My Health record. I'm now going to pass over to Hope, who will present on the Vulnerable Populations Vaccination Program.
Thanks, Mikaela. So, next slide, thank you. So what is the program? It's funded by the Department of Health and Aged Care, DOHAC. Capital Health Network has commissioned 6 primary healthcare providers to promote COVID-19 vaccinations in vulnerable groups that experience challenges in accessing COVID-19 vaccines. 5 of these providers also provide COVID-19 vaccinations for these groups. These groups may include, but are not limited to, those experiencing homelessness, people with disabilities, children with complex needs, Aboriginal and Torres Strait Islander people, people who are culturally and linguistically diverse, people who are not eligible for Medicare, people who are homebound, and aged care and disability workers and residents in aged care homes. Thanks, Mikaela. Why is this program important to residential aged care homes? The latest ATAGI advice for individuals over the age of 75 is that they receive a booster every 6 months. A booster is still recommended even if an individual has had a recent COVID-19 infection. As of the 3rd of July this year, only 47.2% of residents in residential aged care homes in the ACT had received a COVID-19 booster shot in the last 6 months. Residential aged care home workers can also access vaccinations under this program. Vaccination continues to be important in managing the risks related to COVID-19 in high-risk settings such as residential aged care. It's important that workers continue to stay up to date with COVID-19 vaccinations. Workers can access a vaccination through this program during the residential aged care home vaccination clinic for free. They can also attend the participating pharmacies for this vaccination. Yep. A little bit on our providers. So firstly, Women's Centre for Health Matters. Women's Centre for Health Matters has developed a Build Book Boost campaign available in English and soon will be available in 9 other languages. They've developed posters and social media tiles that can be found on their website, and we'll also include a link to these resources in the webinar pack. Meridian delivers on-site clinics to LGBTIQA+ and sex workers. They also provide vaccination and education via outreach. Directions Health provide walk-in vaccinations and pop-up outreach vaccinations clinics via the PAT van to individuals, family members, and friends impacted by alcohol, tobacco, and other drug use, mental health, and other complex health issues. Next, Practice Deakin, Amcar Plus Pharmacy, and Priceline Pharmacy Gungahlin Square or provide COVID-19 vaccinations and education for the target groups under this program, both on their business premises and at the homes of homebound patients. They all provide in-reach COVID-19 vaccination clinics at residential aged care homes as required. Even if your residential aged care home has not used these providers before, you can book an in-reach clinic with them. Their contact details are listed on this slide. Bookings can also be requested by contacting Capital Health Network. Jess Hewson is the coordinator for this program, and her email address is also listed in this slide for you. Thanks, Mikaela.
Thank you, Hope. We will now open the floor for questions. So please use the Q&A function in Zoom and not the chat box to post any questions you have. We also have Wakas from Cal Plus Pharmacy and Christine from Priceline Pharmacy joining us today to answer specific questions about the vaccination program. So if you can, in the Q&A function, just address who your question is for. I'll give everyone a few minutes to type in any questions. Thanks, Kath. Will there be a move to offer other vaccines such as shingles and pneumococcal through the InReach programs? Hope, I think this one's for you.
Thanks, Kath. At this stage, no, we're just talking about the COVID-19 vaccinations, but as soon as there's any movement in that space, we'll certainly be letting you know.
Thanks, Roz. Regarding my health record, do we have any data on how many residents in residential aged care homes have a My Health record?
Sorry, no, we don't have any data on that at the moment.
Hope, I'm kind of happy to jump in here and you can correct me if I'm wrong, but all of the residents should have a record, but they may not be accessing it. So information will be in there, but they may not necessarily access their record. Thank you. Go ahead, Hope. All right.
Sorry, just answering the question, taking part in My Health record, is it mandated for aged care providers or is this optional? So it is optional at the moment.
Thanks, Russ. Can we view residents' immunisation in My Health record? Yes, and that was, I guess, part of the purpose of including the vaccination program in today's webinar, is to say that you can access an immunisation record in My Health record, and then if you are able to do that and identify residents who haven't been vaccinated, then there are options out there for how they can be vaccinated if they're a resident of an aged care home. I'll just give a minute or two extra for any final questions. Thanks, Roz. Can we please clarify who initiates the creation of a My Health record?
I'll take that one. So from a residential aged care home perspective, the Australian Digital Health Agency are providing one-on-one support to set up their My Health Record registration process. Many homes in Canberra are already on that journey in terms of the My Health Record for the individual that is sits with them. And with the support of their representations.
Again, I'll just give another couple of minutes for any last minute questions.
Mikaela, there is a question in the webinar chat. Shrujana has asked who can have access to vaccination record for residents in residential aged care homes. Often we struggle to find the information. Will residential aged care homes nurses be able to access the data? I can take that question. So once the aged care home have been registered to access My Health Record, either through the portal or through your conformance software, the authorised users are able to access the vaccination records for the residents through that process.
Thanks, Hope. I think I missed it, but there was a follow-up question from Roz about who's responsible for creating a My Health Record for individuals. And my understanding for that one, Roz, is that everyone who's eligible for a My Health Record has one by default, unless you've specifically opted out to not have a My Health Record created for you. I'm not sure of the exact process of how they decided who was eligible or not, but I assume it's based on department information like Australians who are registered for Medicare. We've got one more question here. What information is needed to book in a clinic at my residential aged care home with one of the providers?
So if in general, before throwing to Christine, you can just the number of residents that do require that vaccination. And Christine, would you like to complete the answer?
So pretty much we need the patient's name because we need to screen the patients, which is often is what the difficult place in a difficult position in aged care. Not being able to screen the when they had last vaccines. To do that, we need the patient's name, Medicare number, or date of birth. Once we've got that information, if you send us a list, we compile it, we go through it, make sure everybody who's supposed to have a vaccine is entitled to have a vaccine. So that's pretty much what we need. And obviously a consent to vaccinate.
Thanks, Christine. We've got one more question here from Kath. When using conformance software, do you still need the resident's permission?
My understanding, Kath, is that you as long as the provider is registered and authorised, that you're able to access the resident's permission, the resident's record in the circumstances that Mikaela outlined in the presentation.
Thanks, Hope. We'll just give one last minute for any last minute questions. It's great to see everyone being so involved in the Q&A today. So it looks like we don't have any further questions. Just a final reminder for everyone to please complete the post-event evaluation survey that will be emailed out shortly. A copy of resources from today's presentation will be included, and a reminder that today's webinar will be recorded and can be viewed very shortly on the Capitol Health Network YouTube page. You're welcome to share these with your colleagues. Lastly, a big thank you to Christine and Wakas for joining us today, and to Hope for also presenting. I hope everyone enjoys the rest of the day.